Hi, my name's Andrea, and my topic for my paper is global health policy and how access to healthcare affects the overall quality of care in a country. So as Alyssa mentioned, the Declaration of Human Rights does dictate that every person has the right to healthcare, adequate medical care, regardless of their status in society. Unfortunately, this is another article in the Declaration that has not reached reality. So many people around the world have no access to medical care or low quality of medical care that's not sufficient for them. And I found that the quality of care received, or if you receive any care at all, is based on the country you reside in and the policies there, and also the socioeconomic status of the person. So the World Health Organization rates overall a country's quality of health care, but not the access to health care. And I found that there's a large correlation between the access that people overall have to health care and the overall quality of care in a country. So the two major ways that countries divide health care is either public or private. People that have public health care, that means that the government provides health care to everyone regardless of their ability to pay for it. And places like that are Italy and France, and there's plenty of other ones. But Italy and France are the best medical models because they're rated number 1 and number 2 overall in healthcare by the World Health Organization, which is obviously like a great thing. They're way up there. So they're a great model for us to look at. In both Italy and France, everyone is given public health care, which covers their basic necessities. They can buy other health care, private care, if they need extra for dental, medical equipment, things like that. But overall, what they need is paid for. Then we have people that use private health care, or countries that do that, and some countries are the United States and South Africa. So in the United States, which is ranked 37th by the World Health Organization, we have a private sector, which means that we are responsible for getting our own insurance and providing our own care. So that means that we can either get it from employers or buy it on our own, or there are a few government policies that will give medical benefits to people that are disabled or elderly, things like Medicare and Medicaid, but that still leaves about 45 million Americans uninsured and about 25 million Americans underinsured, which is a significant amount. In South Africa, they have a mixed healthcare system, which means that there's a public and a private sector, but there's a huge disparity between them, and this leaves South Africa ranked 175th out of 191 states, so that's obviously very low, and leaves a lot of room for improvement. So based on the World Health Organization research, I found that public health care increases the quality of care overall, and that even though access to health care isn't the whole picture, it has a really significant effect on the quality of care in a country. So if you have increased access to medical care, overall the quality of care in that country is going to be much better. So what I found is that in an ideal situation, if we really want to have universal health care for everyone, that we should all make the switch, all the countries, to public health care. And a lot of countries are undergoing reform right now. In the US, we have Obamacare, which does not create public health care, but it does make movements toward that direction. So the goal of Obamacare is basically to increase accessibility to care and decrease costs, so that will leave less people uninsured. And in South Africa, they're also reforming with something called the National Health Insurance Fund, which basically means that the goal of that is to have health care for everyone. So I think that other countries should definitely follow suit towards the public health care so that people in the world are not left uninsured. And that's all I have. Thank you.
So why did you pick this topic?
I'm a pre-physician assistant major. So as a future healthcare provider, this really interested me because obviously I'm a big advocate for healthcare and how important it is in people's lives. So everyone should have it. That's it. Thank you.